Okay, let's continue further. So, what is rapid cycling? If you're talking about rapid cycling bipolar disorder, if we are talking about rapid cycling bipolar disorder, means what? Whenever a person is having more than four episodes in a year, when a person is having four or more than four episodes in a single year, it is called to be rapid cycling bipolar disorder. Okay, how can you treat the patient? How can you treat the patient? Treatment of this patient you can do by Valpro 8. You can treat the patient with the help of Valpro 8. So we have talked about two depressive disorder, one depressive disorder and one more about bipolar disorder. Now coming to other mood disorders, this mood disorder is also called to be persistent disorders. Means this remains persistence throughout the year or throughout the time of in a patient's life. Two things: dysthymia and cyclothymia. Okay, these are called to be persistent disorders. So, what do you mean by dysthymia? Dysthymia is nothing but it is presence of mild depressive symptoms. But yes, these mild depressive symptoms are not enough to diagnose it as major depressive disorders. But this should be for at least a period of 2 years. This should be at least a year of 2 years. And yes, socio-occupational functioning is not markedly impaired because, as we said, it is mild depressive disorders. And in DSM-5 classification, it is called to be persistent depressive disorders. When we draw on a graphical representation, when we draw it on a graphical representation, it is like this way. This is are having symptoms, and it will be like very minute one. It is not a major one. It will be consistent throughout the year, but at a certain time there will be a depressive disorder major. So this is what a persistence one, right? So this is what a persistence one. Yes, and this is a gap of how many years? 2 years. अगर 2 साल तक mild symptoms रहते हैं उसको we call it as dysthymia. But most important thing, when a dysthymia is followed by depression, this is what? This is depression. So whenever a dysthymia is followed by depression, dysthymia is followed by depression, this is called to be what? This is called to be double depression. This is called to be what? It is called to be double depression. Okay. Fine enough. Fine enough. Coming to cyclothymia. What is cyclothymia? It is a milder form of bipolar disorder in which both manic symptoms are there as well as depressive symptoms are there. But they are not severe enough to make diagnosis of mania or hypomania. Or it may be depression. But for at least 2 years. Again, we'll talk about at least 2 years. And even the same thing, socio-occupational functioning will not be impaired. Okay. So like it will be a तेरी बारी मेरी बारी तेरी बारी ठीक है. Fine enough. Consider this to be a depression, this to be a mania or hypomania, followed by a followed by uh, hypomania symptom, but there will be no gap. So here it will be. अगर ये खत्म हो गया, then again there will be sadness part, but there will be no gap of time in this. Am I done with this thing? And this should be continued for almost like 2 years के लिए ये same चीज होनी चाहिए. Then you can say it as it is a cyclothymia. Done with this thing? Good enough. Suicide. बहुत सारे लोग सुसाइड ये नहीं हुआ वो नहीं हुआ सुसाइड कर लेते वगैरह वगैरह है ना. So what is suicide? Suicide सबको पता है. What is the rate of suicide in India? It is almost 12 per 1 lakh population. 12 per 1 lakh population. Most common method in India it is hanging. पंखे से लटकना, गर्लफ्रेंड के दुपट्टे से लटकना है ना, सब बहुत कॉमन है आजकल. इट इज हैंगिंग एंड आफ्टर दैट हैंगिंग इट इज पॉइजनिंग. Psychiatric illness associated with higher risk of suicide is nothing but it is depression. Am I done with this thing? So what are risk factors for suicide? Most important one. Number one, previous attempt of suicide. Previous attempt of suicide. Second was hopelessness. It is what? Hopelessness. Other risk factors. Yes. Male. अनमेरिड कुंवारे बहुत जल्दी सुसाइड करने के सोचते हमको ये लड़की नहीं मिली उसने मना कर दिया उसने मना कर दिया इट इज मेल अनमैरिड and if even if a patient is suffering from chronic illness he may be have depressive thought of suicide he or she may be a kind of abuse or maybe substance abuse can be there or maybe due to delirium or hallucination can be reasons for this suicide. Then, what do you mean by paradoxical suicide? One more definition in this chapter, last one. What is paradoxical suicide? It is the initial stage. It is what it is initial stage of treatment and recovery. It is initial stage of treatment and recovery. Then, what happens? A patient attempts suicide. So initial stage of treatment, anyone the next time when patient attempts suicide, उसके बीच में क्या होता है? Gain of energy. Patient gains energy to do suicide, and then he or she attempts suicide. Last, not the least, what do you mean by copycat suicide? बचपन से सुना होगा copycat means one who is copying. Same funda over here. Copycat suicide means one who is copying another one to do suicide. So mimicking method of suicide. It is called to be what? Copycat suicide. Most commonly seen in adolescents. Most commonly seen in adolescents, followed by children. Followed by children. So what we are going to do now? We have completed over the for this chapter about mood disorders, and now we are going to take a short and sweet, simple, easiest topic of eating disorders. Okay, let's come to eating disorders. खाना सबको बहुत प्यारा होता है. That is eating disorder. The first one in eating disorder we are going to talk about anorexia nervosa. In anorexia nervosa, it is loss of appetite. A person will having a loss of appetite. Up now, if we talk about epidemiology, this is most commonly seen in females than males. Females are more commonly affected by anorexia nervosa, and most common age of onset of anorexia nervosa is 14 to 18 years. Is what? 14 to 18 years. Again, okay, I am writing again in good handwriting. It is 14 to 18 years. Okay, what are the characteristics? It is characterized by restriction of energy intake resulting in significant less weight than normal. अगर वो खाना नहीं खाएंगे उनका वेट ऐसे ही कम होने वाला है. दिस पेशेंट को इन सब पेशेंट को डर होता है कि मेरा वेट बहुत बढ़ जाएगा. एक्सेसिव फियर फैटनेस, एंड दे हैव अ वेरी दे आर लाइक हैविंग डिस्टर्ब्ड इमेज ऑफ बॉडी. मतलब बॉडी की बहुत डिस्टर्ब्ड इमेज लगती है उनको. डिस्टर्बेंस ऑफ बॉडी इमेज मींस व्हाट? कि उनको लगता है मैं बहुत जाड़ी हो गई, बहुत वो हो गई, मोटी हो गई, वगैरह वगैरह. ओके, फाइन. व्हाट इज रिमोट? पहले के टाइम पे इस टाइप में क्लासिफिकेशन में देता थे एमेनोरिया. Okay, but now amenorrhea is not a part of anorexia nervosa. What is not a part of anorexia? What is not part of anorexia nervosa? It is amenorrhea. And what are the signs and symptoms of starvation seen in this patient? So there are subtypes. The first one is called to be restricting type, and second one is called to be binge eating or purging type. A binge eating you very well know. More amount in less time. मैं पहले यहाँ पे लिख देता हूँ more amount in less time. और ये लोग क्या करते थे? डू सेल्फ इंड्यूस्ड वॉमिटिंग. अपनी ही उंगली मुंह में डाल के वो खाना बाहर निकाल देते. सो व्हाट इज इट इज? सेल्फ इंड्यूस्ड वॉमिटिंग, उनको ऐसे लगता है कि उन्होंने बहुत खा लिया है. ओके. और रिस्ट्रिक्शन तो यू वेरी वेल नो, intake is less of food. Intake is less of food. Okay, how you are going to treat this patient? Up, this is nothing much more, but it is treated by CBT and SSRI, selective serotonin reuptake inhibitors, and CBT. What is CBT? Cognitive behavioral therapy. Sometimes hospitalization may required. Hospitalization may be required. May be required. What are complications? What are complications of this patient? Because as they are not eating and drinking much, a person can suffer from dehydration, and there can be imbalance in what terms? Electrolytes. खाना ही नहीं खा रहे तो electrolytes कैसे balance हो गए? Yes or no? So there is going to be imbalance in electrolytes level. Weight or height can be decreased by 20%. But this aspect is morely attached towards weight, not height. It is morely relatable to weight. Okay. So, what is the next step? Next step is nothing but we observe the patient after meal. We observe the patient what he or she is doing after meal. ये वो खाना निकाल दे रहे हैं या they are not doing anything this time. One more part we are going to talk about is bulimia nervosa. हमने बात किया एनोरेक्सिया नर्वोसा, अभी हम बात करें बुलिमिया नर्वोसा. Bulimia nervosa is same as anorexia nervosa. Female are morely affected than male. Onset कब होता है? Onset is seen in late adolescence. Up, if you remember, in pediatrics, I talked about adolescents were three part. Adolescents have three classification: early adolescence, mid adolescence, and late adolescence. है ना? So that is what late adolescence, or you can see it as an early adulthood. We can call it as early adulthood. Okay, fine enough. What is body mass index? BMI will be normal, or it may be more or high as compared to normal values. What are the findings? Clinical findings you can see in this bulimia nervosa. They do have episodes. There are various episodes can be noted in binge eating. Means what is binge eating? I already mentioned in the upper slide. Increase amount of food intake in lesser time. Lesser amount of food intake in lesser time. Okay. Compensatory behavior. What they do? At least 1 week, at least one time over week, 1 week for 3 times. ओके, ये अलग पॉइंट है, पहले ये देख लीजिए व्हाट इज कंपेंसेटरी बिहेवियर. कंपेंसेटरी बिहेवियर व्हाट दे डू पर्जिंग. व्हाट इज पर्जिंग? सेल्फ इंड्यूस्ड वॉमिटिंग, करेक्ट. Self induced vomiting, which is most common, they do use laxatives and diuretics. Should have this at least once a week for 3 months. For how many time? At least once per week for 3 months. Fine enough. Coming to next point, complications secondary to purging. अब what happens purging होता है वो लोग जानबूझ के. Fine. I hope everything is fine enough. Am I visible? Is my screen visible? Okay. So what are the complications secondary to purging? I already mentioned, अगर purging कर रहे हैं, whatever the acidic food which is present in the stomach, it will come out. And as this acidic medium food will come out, the person can suffering from dental caries. A person is suffering from dental caries, or it can be parotitis. It can be parotitis. It can be parotitis. Sorry. Okay. Okay. Fine enough. There is a specific sign which we can see in this patient. It is called to be Russell's sign. This is not your cricketer Andrew Russell. It is Russell's sign, different from your Kolkata Knight Riders player. Yes. Okay. This is Russell's sign, which we can see callus on knuckles. On this part here, we can see callus formation. And fourth thing, what we can see is there is decreased decreased potassium level and decreased chlorine level. And what is most commonly seen? Alkalosis. What is alkalosis? Okay, last. Binge eating disorder, which is new one. Only episodes of binge eating, but there is no compensatory behavior. तो उसमें इसमें क्या होगा? Of course, BMI will increase, or maybe it can remain normal. Chances are there it can remain normal. Okay, fine. So here we have concluded binge eating disorders. Okay, we have completed binge eating disorders. If you're having doubt, you can text me on my number. Fine. Done. Thank you. Goodbye. Have a good day.